Hi, everybody. Thanks for meeting with me today. I wanted to take a minute and talk to everyone about our diabetic patients in our clinics. We have so many cases of diabetic retinopathy. Of course, that's what we do. We're retina. So we deal with the worst of the worst. But I think our challenge for the next year should be, how can we prevent the severe cases? How can we take these individuals and start from the beginning and say, this is what's going on in your eye. This is what your eye looks like now. This is what is going to happen if your diabetes is not controlled. We know that we talk to them about seeing their diabetic doctor every year. Their diabetic doctor says, hey, go get an eye exam. They come to us, we put some drops in their eye, we have them sit in the waiting area for 20 minutes, and then we take some pictures. We say everything looks okay and come back in a year or 6 months, depending on how long they've been diabetic. I think that at this point, if we took just 20 minutes while they're dilating, had a diabetic counselor sit down with them, and I know the doctors express the importance of the diabetes. I'm not taking away from that. We do go over their photos with them. But I think a diabetic counselor sitting down step by step saying, okay, you've been diagnosed with diabetes. This is what your eye looks like. This is what's going on in your eye. This is what's going to happen over time, and this is why we need to look at it by showing them the actual photos of their eye and saying, okay, these are the areas that are problematic. We do that to some degree, but usually we don't hit on it until there's microaneurysms or a problem, and then we start talking about the issues that they need to have done, the anti-VEGFs, the PRP laser, vitrectomies in the extent that it is very bad. I feel that it's important, and I know all of you do too, that we're discussing all of these things with our patients. And if we started from day one, how many of these cases could we prevent? We have people come in very frequently and say, oh, well, I see fine, so I didn't think it was that important. I know my doctor said to come in, but I just kind of thought, well, I see okay, so I don't need to be seen. By explaining to them all of the areas of their eye that retinopathy starts from the outside in, before they ever have a problem, how many cases do we have the ability to stop and turn around and say, okay, this is important. This is what's going to happen if you don't control it now. If you are diabetic for a long period of time, if you were diabetic from childhood, your risks are so much higher. And this is why it's important. This is what your eyes look like now. They're fine. But this is what could potentially happen if we don't check them every year. So it's one of the things that, we get complaints that patients feel like they're herded in and out. They are cattle. And we see that on our Google reviews. This would also alleviate them feeling like they're cattle and in and out by taking those extra moments to sit down and say, your eyes are okay today, but this is what happens within your eye in the future. This is what we need to do to protect you. By the time you're going to see changes, it's going to need treatment that's uncomfortable and expensive, and we can prevent that. We already provide people with multilingual resources. I think we should expand that as well. We are getting more and more people every year with different nationalities, and we are starting to provide pediatrics. So sitting down and kind of revamping our patient education material is really important, and I think that we can spend a little bit of extra time using the resources we already have to help prevent further issues in the future for our patients. And I think they'll appreciate the time that we spend with them, and a technician can do that. We have cataract counselors. I would like to extend that to diabetic technician counselors, and I think that our patients would appreciate it. I know that that takes a little bit of pressure off of the doctors, and so that could make a really good cooperative team for everybody. Thank you.